Welcome to today's Medicare 360 show. I'm your host, Jennifer Lee, and we are getting started with finding out what Medicare covers in the Medicare New Handbook um, 2025. So we are going to begin with page 50 today. Rural health clinic services. Rural health clinics provide many outpatient, primary, and preventive services in rural and underserved areas. Generally, you pay 20% of the charges. The Part B deductible applies. You pay nothing for most preventive services. Second, surgical opinions. Medicare covers a second surgical opinion in most cases for medically necessary surgery that isn't an emergency. In some cases, Medicare covers third surgical opinions. Pay 20% of the Medicare approved amount. The Part B deductible applies. Preventive services. Sexually transmitted infection, STI screenings, and counseling. Medicare covers STI screens for chlamydia, gonorrhea, syphilis, and or hepatitis B. Medicare covers these screenings if you're pregnant or increased risk for an STI when your primary care doctor or other healthcare provider orders the test. Medicare covers these tests once every 12 months or at certain times during pregnancy. Medicare also covers up to individual 20 to 30-minute face-to-face high-intensity behavioral counseling sessions each year if you're a sexually active adult at increased risk for STIs. Medicare will cover these counseling sessions with a primary care doctor or healthcare provider in a primary care setting like a doctor's office. Medicare won't cover counseling as a preventive service as an inpatient setting like a skilled nursing facility. Yeah, I think sometimes uh, seniors are very active in those facilities. You pay nothing for these services if your primary care doctor or provider accepts assignment. Shots or vaccines. Part B covers flu shots, go to page 41. Hepatitis B shots, go to page 42. There's just an outbreak of that if you haven't heard lately. And pneumococcal shots, go to page 48. Coronavirus disease 2019, COVID-19 vaccines, go to page 37. So, important through March 31st, 2025, you could get telehealth services at any location in the US, including your home. Starting April 1st, 2025, you must be in an office or medical facility located in a rural area in the United States for most telehealth services. However, you still could get Medicare telehealth services without being in a rural healthcare setting, including monthly end-stage renal disease, ESRD visits for home dialysis, services for diagnosis, evaluation, or treatment of symptoms of an acute stroke, whether you are including a mobile stroke unit. Services for the diagnosis, evaluation, or treatment of a mental and or behavioral health disorder, including a substance use disorder in your home. You pay 20% of the Medicare. Where is that? You pay, where am I at? Sorry. Let's start over again. So important, Medicare drug covered Part D generally covers all other adult immunizations recommended by the Advisory Committee on Immunization Practices to protect you from diseases like shingles, tetanus, diphtheria, pertussis, and respiratory syncytial virus, RSV, at no cost to you. If the shot isn't on your plan's drug list yet, you can ask for coverage and a coverage exception or get reimbursed. Contact your plan for details and talk to your doctor or other healthcare provider about which vaccines are right for you. To learn more about covered vaccines, visit medicare.gov/coverage. Okay, We're at page 51. Medicare covers medically necessary evaluation and treatment to regain and strengthen speech and language skills. This includes cognitive and swallowing skills to improve or maintain current function or slow decline when your doctor or other healthcare provider certifies you need it. You pay 20% of the Medicare approved amount. The Part B deductible applies. Surgical dressing services. Medicare covers medically necessary treatment of a surgical or surgical treated wounds. You pay 20% of the Medicare approved amount for your doctor or other healthcare provider services. You pay a set copayment for these services when you get them in a hospital outpatient setting. The Part B deductible applies. Telehealth. Medicare covers certain telehealth services you get from a doctor or other healthcare provider who's located somewhere else using technology to communicate with you in real time. Important, through March 31st, 2025, you get telehealth services at any location in the US, including your home, starting 1st April 2025. US being office or medically facility located in rural areas in the US for most telehealth services. However, you can still get Medicare telehealth services without being in a rural area setting, including monthly end stage renal disease, visits for home dialysis, services for diagnostics, evaluation, or treatment symptoms of an acute stroke wherever you are, including a mobile stroke unit. Services for diagnosis, evaluation, or treatment of a mental and or behavioral health disorder, including a substance use disorder in your home. I totally apologize. I reread this again, but hey, sometimes you want to just listen to it twice. Okay, so you pay 20% of the Medicare approved amount for your doctor or other healthcare provider or practitioner services. The Part B deductible applies. For most of these services, you pay the same amount you would if you got the services in person. Compare. Medicare Advantage plans and some providers in original Medicare may offer more telehealth benefits than the basic coverage in original Medicare. For example, you may be able to get some services from home no matter where you live. If your provider in original Medicare participates in an accountable care organization, check with them to find out what telehealth benefits may be available. Go to pages 110 to 111 for more information about ACOs. So keep in mind, maybe you were doing telehealth visits with your doctors in the past. Make sure that it is covered, because I am hearing some of my clients complain that now it's no longer covered or the doctor won't do it because it's not covered by Medicare. So just make sure it is covered if that happens. Tests, non-laboratory. Medicare covers x-rays, MRIs, CAT scans, EKGs, ECGs, and some other diagnostic tests. You pay 20% of the Medicare approved amount. The Part B deductible applies. Okay. If you get the test at a hospital as an outpatient, you also pay the hospital a copayment that may be more than 20% of the Medicare approved amount. Most cases, this amount can't be more than the Part A hospital say deductible. Go to laboratory tests on page 44 for other Part B covered tests. Transitional care management services. Medicare may cover this service if you're returning to your community after an inpatient stay at certain facilities like a hospital or skilled nursing facility. The healthcare provider who's managing your transition back into the community will work with you and your caregiver to coordinate and manage your care for the first 30 days after you return home. The Part D deductible and coinsurance apply. Visit medicare.gov/coverage/transitional-care-management-services to learn more. Transplants and immunosuppressive drugs. Medicare covers doctor services for heart, lung, kidney, pancreas, and intestine, and liver transplants under certain conditions, but only in Medicare certified facilities. Medicare also covers bone marrow and cornea transplants under certain conditions. Medicare covers immunosuppressive drugs if Medicare paid for the organ transplant. You must have Part A the time of the covered organ transplant, and you must have Part B at the time you get immunosuppressive. Oh my gosh, immunosuppressive drugs, or qualify for the immunosuppressive drug benefit described on this page. You pay 20% of the Medicare approved amount for the drugs. The Part B deductible applies. Keep in mind Medicare coverage, Part D covers immunosuppressive drugs if Part B doesn't cover them. If you're thinking about joining a Medicare Advantage plan and are on a transplant waiting list or think you need a transplant, check with the plan before you join to make sure your doctors and other healthcare providers and hospitals are in the plan's network. Ask for information about covered drugs and their costs. Also, check the plan's coverage rules for prior authorization and coverage for your living donors. Medicare may cover transplant surgery as a hospital inpatient surgery under Part A. Go to pages 27 to 28. Medicare pays the full cost of care for your kidney donor, and you and your donor won't have to pay deductible, coinsurance, or any other costs for their hospital stay. Immunosuppressive drug benefit. If you only have Medicare because of end-stage renal disease, your Medicare coverage, including immunosuppressive drug coverage, ends 36 months after successful kidney transplant. Medicare offers a benefit to help you pay for your immunosuppressive drugs beyond 36 months if you don't have certain types of other health coverage, like a group health plan, TRICARE, or Medicaid that covers immunosuppressive drugs. This benefit only covers your immunosuppressive drugs and no other items or services. Okay. It isn't a substitute for health coverage. You can assign up for this benefit anytime after your Medicare Part A coverage ends, as long as you had Medicare because of ESRD at the time of your kidney transplant. To sign up, call Social Security 877-465-0355, or you could call 800-325-0788. You'll pay a monthly premium of $110.40 or a higher base of your income and $257 deductible for immunosuppressive drug benefit in 2025. Once you met the deductible, you pay 20% of the Medicare approved amount for immunosuppressive drugs. If you have limited income and resources, you may be able to get help from your state to pay for this benefit. Go to page 94 or visit medicare.gov/basics/end-stage renal disease to learn more. Travel. Medicare generally doesn't cover health care while you're traveling outside the U.S. The U.S. includes the 50 states, the District of Columbia, Puerto Rico, the U.S. Virgin Islands, Guam, the Northern Mariana Islands, and American Samoa. There are some limited exceptions. Visit medicare.gov/coverage. Travel outside in the U.S. to learn more. Medicare may cover medically necessary ambulance transportation to a foreign hospital only with admission for medically necessary covered inpatient hospital service. You pay 20% of the Medicare approved amount. The Part B deductible applies. Okay, yeah, keep this in mind. If you are on original Medicare, it generally doesn't cover the healthcare outside the U.S. Of course, if you do get a supplemental plan, these plans typically have a $50,000 lifetime maximum. You do have to pay a deductible and the coinsurance for that. On Medicare Advantage plans, typically you don't, you might have a deductible or a copay, but it is covered. Some plans have unlimited coverage. Some plans have a certain coverage limit. Okay, urgently needed care. Medicare covers urgently needed care to treat a sudden illness or injury that isn't a Medicare emergency. You pay 20% of the Medicare approved amount for your doctor or other healthcare provider services, a copayment in an outpatient setting. The Part B deductible applies. Virtual check-ins. Medicare covers virtual check-ins in with your doctor or certain other providers. Virtually check-in allows you to briefly communicate with your healthcare providers using audio or video communication technology like your phone or a computer without getting to the doctor's office. Your doctor can also conduct remote assessments using photo or video images you send for review to determine whether you need to go to the doctor's office. Your doctor or other provider can respond to you by phone, virtual delivery, secure text message, email, or patient portal. Virtual check-ins are different from telehealth visit because they're usually 10 minutes or less and aren't done in real time. You can also have a virtual check-in if you meet these conditions. You talk to your healthcare provider about starting these type of visits. You virtually consent to the virtual check-in, and your doctor documents your consent in your medical record. Your doctor may get one consent for a year's work for these services. The virtual check-in doesn't relate to a medical visit you had within the past 7 days, and it doesn't lead to the medical visit within the next 24 hours or the soonest appointments available. Okay, we're at page 54. Compare. You pay 20% of the Medicare approved amount for your doctor or other healthcare provider services. The Part B deductible applies. Medicare Advantage plans may offer some virtual check-in services than original Medicare. Check with your plan to find out what they offer. Preventive services. Welcome to Medicare Preventive Visit. During the first 12 months that you have Part B, you could get a Welcome to Medicare Preventive Visit. The visit includes a review of your medical and social history related to your health. It also includes education and counseling about preventive services, including certain screening, shots, or vaccines like flu, pneumococcal, and other recommended shots or vaccines, and referrals for other care if needed. When you make your appointment, let your doctor's office know you'd like to schedule your Welcome to Medicare Preventive Visit. You pay nothing for the Welcome to Medicare Preventive Visit if the doctor or other qualified healthcare provider accepts assignment. If you have a current prescription for opioids, your provider will review your potential risk factors for the opioid use disorder, evaluate your severity of pain and current treatment plan, provide information on non-opioid treatment options, and refer you to a specialist if appropriate. Your provider will also review your potential risk factors for substance use disorder and alcohol and tobacco use and refer you for treatment if needed. Report it if your doctor or other healthcare provider performs additional tests or services during the same visit that Medicare doesn't cover under the preventive benefit. You might also have to pay co-insurance, and the Part B deductible may apply. Medicare doesn't cover the additional tests or services like a routine physical exam. You may have to pay the full amount. Preventive services, yearly wellness visit. If you had Part B for longer than 12 months, you could get a yearly wellness visit. The yearly wellness visit isn't a physical exam. It's a visit to develop or update your personalized plan to prevent disease or disability based on your current health and risk factors. Medicare covers this visit once every 12 months. Your doctor or healthcare provider will ask you to fill out a questionnaire called a health risk assessment as part of this visit. You may also visit including routine measurements, health advice, a review of your medical and family history, a review of your current prescriptions, advanced care planning, and more. Your doctor, healthcare provider may also use questionnaire to better understand your social needs and refer you for appropriate services and support. This is called a social determinants of health risk assessment, and it's free when you get it as part of your yearly wellness visit. For information, visit medicare.gov/coverage. Your doctor or healthcare provider will also perform a cognitive assessment to look for signs of dementia, including Alzheimer's disease. Signs of cognitive impairment include trouble remembering, learning new things, concentrating, managing finances, and making decisions about your everyday life. If your doctor or healthcare provider thinks you may have cognitive impairment, Medicare covers a separate visit to do a more thorough of your cognitive function and check for conditions like dementia, depression, anxiety, or delirium, and design a care plan, page 35. Your doctor or healthcare provider will also evaluate your potential risk factors for substance use disorder and refer you for treatment if needed. If you use opioid medication, your provider will review your plan treatment share information about non-opioid treatment options, and refer you to specialists as appropriate. Your first yearly visits, your first yearly wellness visit can take place within 12 months of your Part B enrollment, or your welcome to Medicare preventive visit. However, you don't have to have a visit to Medicare preventive to qualify for a yearly wellness visit. You pay nothing for the yearly wellness visit if the doctor or healthcare provides accepts assignment. Important, if your doctor or healthcare provider performs additional tests or services during your wellness visit that Medicare doesn't cover under the preventive benefit, you may have to pay coinsurance and Part B deductible may apply. Medicare doesn't cover the additional tests or services like routine physical exam. You have to pay the full amount. When isn't covered, what is it covered by Part A and B? Medicare doesn't cover everything. If you need certain services, Part A or B doesn't cover. You'll have to pay for them yourself unless you have other coverage, including Medicaid, to cover the cost. You're in a Medicare Advantage plan or a Medicare cost plan that covers these services. Medicare Advantage plans and Medicare cost plans may cover some extra benefits like fitness programs and vision, hearing, and dental services. Some of the items and services that original Medicare doesn't cover include eye exams for prescription eyeglasses, long-term care, cosmetic surgery, massage therapy, routine physical exams, hearing aids and exams for fitting them, concierge care, also called concierge medicine, retainer-based medicine, boutique medicine, platinum practice, or direct care. Covered items are services you get from a doctor or other provider that has opted out of participating in Medicare, except in the case of an emergency or urgent care or urgent need, or go to page 60. Most dental care, in most cases, original Medicare doesn't cover dental services like routine cleanings, fillings, tooth extractions, or items like dentures. However, in some cases, original Medicare may pay for some dental services closely related to certain covered services like a heart valve repair or replacement, an organ transplant, cancer-related treatments, paying for long-term care. Medicare and most health insurance, including Medicare supplements, insurance, Medigap, don't pay for these type of services. Okay, this includes personal care assistance like help with everyday activities, including dressing, bathing, using bathroom. Non-medical long-term care services may also include home-delivered meals, adult day health care, home and community-based services on others. You may be eligible for some of these care through Medicaid, or you could choose to buy private long-term care insurance. You could get non-medical long-term care services at home, in the community, in an assisted living facility, or in a nursing home. And it's important to start planning for non-medical long-term care now to maintain your independence and to make sure you get the care you may need in the setting you want and now in the future. Yeah, this is definitely something that is not covered. I've been seeing it a lot more with my older clients or their parents, that basically Medicare does not cover long-term care, and they either have to go out of their pocket, or a relative or the son or daughter or even the grandkids help out in the situation, can take turns. But sometimes it is a big ordeal, and I do recommend looking at your long-term care options out there just in case, this is needed in the future. But we're going to end that for today. Look forward to next week. As always, please feel free to reach out to us if you have any questions. Take care and have a wonderful day.